It's been a long, hard winter, but spring and summer are right around the corner. You can almost feel it in the air. A change in the weather also means that we're approaching tourist season, a crucial time of year for so many businesses and for our state's economy as a whole. We want our state to be both welcoming and safe, to make sure we can live up to our vacation land brand and reassure all visitors that Maine wants them to be safe while they're here. And so I am unveiling today the Moving Maine Forward plan. This plan is our approach to public health and to protecting public health and supporting Maine's economy. The plan has three primary parts: maintaining critical public health measures, establishing standard capacity limits and timelines for those across the state, and updating our travel policy to allow freer travel in and out of the state of Maine. So first, maintaining public health measures. Even as we vaccinate more and more people, we know that COVID-19 and some of the emerging variants remain a serious health risk, and that the best way to head off that threat is to do a few basic things. We all should wear a mask, watch your distance, avoid crowds, and wash your hands frequently. Over the past year, we've worked with different sectors of the economy to develop and implement specific public health measures for their businesses and activities. These measures and the protocols for specific activities, when they've been adhered to faithfully, have worked. The US CDC and the Maine CDC tell us it's important to stick with those measures. They're common sense. So under the Maine Moving Forward plan, we're maintaining those critical health and safety protocols that have protected people over the last year, like wearing face coverings, keeping physical distance, et cetera, and the specific COVID-19 prevention checklists, which are critical to keeping businesses safe for Maine people and reassuring visitors that they'll be safe in our state. These protocols provide a critical level of protection, and businesses have successfully implemented them over the year. Secondly, establishing standard capacity limits and timelines across sectors. This plan, the Moving Maine Forward plan, also makes major changes to our indoor and outdoor capacity limits in the coming months. First, we're moving away from that hard cap capacity limits, the 50 person limit, for instance, we've had across most sectors, to a percentage model, percentage of space model. Secondly, we're establishing a time frame to increase capacity limits across all economic sectors to provide a measure of uniformity and predictability. So for all indoor gatherings, limits will increase to 50% of their permitted capacity starting March 26. And assuming all goes well, that limit will increase to 75% starting May 24th. So March 26th, it goes to 50% of your indoor capacity limits, and 75% starting May 24th. For all outdoor gatherings, capacity limits will increase to 75% on March 26th and to 100% starting May 24th. For all outdoor gatherings, that will increase accordingly. So this timeline provides our hospitality and retail and other industries with a clear idea of what to expect. Of course, we retain the flexibility to adjust these figures if necessary. For example, if things go south on us, we could dial down the capacity limit from 75 to 50%. Or if a new variant strain poses a significant risk to public health, something unexpected at this time. But we can all avoid this scenario by getting vaccinated and continuing to take all safety precautions, not letting down our guard. I should also note we plan to open bars and tasting rooms on March 26th as well. Many of these businesses have been operating takeout service or have offered outdoor seating or have adopted restaurant protocols to open their doors. This change will allow those who have not yet opened their doors to open to indoor service again within the public health protocols for that particular business. So, travel policy. The third thing that the new plan does, it updates our travel policy in both the short term and long term, and it'll reflect changes in the coronavirus pandemic since last summer's tourist season. Currently, everyone who comes into the state of Maine must either test or quarantine coming into the state of Maine or returning to the state of Maine, unless they're from a state that's specifically exempted by the Maine CDC. Currently, that's New Hampshire and Vermont only. Effective today, immediately, We're adding Massachusetts, Connecticut, Rhode Island to the list of states that are exempt from that requirement. So people can now move freely among the New England states without testing or quarantining. In addition, people coming from other states outside New England will not have to quarantine or have a negative test if they've been fully vaccinated or if they've recently had COVID-19 and have recovered. These individuals are no longer required to test or quarantine when coming into Maine, regardless of the state or of origin. But keep in mind there are some federal requirements that relate to international travel, and those, of course, remain in effect. Now, that's immediately. May 1st, we're going to shift that travel policy from an all states included unless exempt to a all states exempt unless included model. Let me be a little clearer about that. That will mean as of May 1st, all travelers from other states can come to Maine without having to test or quarantine unless they come from states that are determined by the CDC to have a high prevalence of contagion, COVID-19 variants. If one or more states see a spike in the variant cases, Maine can and will reinstate the test or quarantine requirement for those travelers from that state or for Maine people returning from that particular state. Right now, Maine, adjusted for population, ranks second lowest in the nation in total hospitalizations. We rank third lowest in the total number of cases and fourth lowest in the number of cases from COVID-19. We want to keep it that way. We want to have those good case numbers. Our 7-day testing volume is 8th best in the nation. And our positivity rate over the past 14 days is second lowest in the nation. We've administered more than 391,000 doses of vaccine, and more than 253,000 people, or almost 19% of the population, have gotten their first dose. And more than 138,000 people, or more than 10% of the population, are now fully vaccinated.